Keith, great to see you. We meet again.
Yeah, we see each other quite a lot, but
do.
we're at all the best events.
We are, and we haven't had a chance to catch up properly in a little while, have we? So
No, because the last time we spoke was, I think, properly was in the lead up to Giant, wasn't it? Yeah. Oh, we've spoken between times, but that was the last proper long chat.
Yeah, absolutely. So, how are you finding health?
It's amazing, overwhelmingly amazing. I mean, Henry and the rest of the health team do promise an experience, and they absolutely deliver that. But they also deliver a great collection of people from all over the place. There's a large number of people from the UK. There's a bit of a sort of UK away day as well. The quality of the stands, the exhibitors good. There's been some great talks. But this year's felt there's a really interesting sort of energy of getting stuff done. And this conference in particular, compared to a lot of the other conferences that I've gone to, I feel as though I've had conversations that have had meaning and advanced my own thinking, but really concrete plans about making changes in healthcare, be that AI within the NHS and clinical safety, data protection, all those things. So I was just saying as we came across here, I'm kind of pretty amped up by it all. So I'm looking forward to a calm moment afterwards.
Calm moment. And what have been some of your takeaways, specifically, obviously in the context of what we're talking about in artificial intelligence? What are some of those key takeaways or thoughts that have stimulated thoughts for you? So
when I sort of think about artificial intelligence now, I just think of it more as like it's not a separate thing, it's across everything, and everyone's either talking about it or they've got something involved. What I've seen is that a lot of the things that I'd hoped for, which was excitement and interest in the capabilities of what artificial intelligence can do, but also realism about what it means to do it responsibly and do it right. Not in a way that sometimes put across that it's a sort of barrier to doing something right. It's these kind of like boundaries that actually force people to think really creatively in the space in between, which ends up meaning that the things that come off the back of it, the products and the services, are not only safer, more effective, more equitably distributed, but actually more likely to get in front of patients and change their lives. I think when people didn't talk about that, they were just kind of wishing for something and then it would hopefully make a change. But people are more realistic about it now. They've got experience of getting things out there now. They're sharing how it's done, and they're also sharing the problems that they're having, and there are enough people here to start talking about, well, how do we address the problem? And that's been the big takeaway from me. There's a lot of excitement about ambient voice technology. We've had Heidi and Tandem and other people here as well. I've seen Dom here from Tortoise as well. And because of a lot of the communications coming out about what it is to be ambient voice technology that is safe and compliant, is it a medical device? Answer is yes. What type of medical device and everything? That's slowly coming into focus. But there's still some grey areas that are leading to really active discussions, and there's been a lot of that here today. And
so something that I've observed is there's been more discussion around post-market surveillance.
Yes.
I've noticed that, and I guess that kind of ties into what you've been talking about here, about the realities of implementing artificial intelligence into healthcare.
Yes, and in fact, I understand it was even 2 days ago there was a new publication coming out with much more detail about this too. So busy has health been that I haven't even had a chance to properly read it just yet, so there'll be some nighttime reading in there too. But yes, you can put in the work to show that something is safe and effective and compliant to start, but that is not the end of the story. The end, artificial intelligence promises a great deal because it can adapt, it can be iterated upon. But even if it didn't, you would still want to watch and how it worked in the real world. So this post-market surveillance, which has been happening for a while, is becoming kind of more mainstream. There's a little clearer as to what's going on. Like I said, I'm going to have to read the latest missive to see exactly the detail on that. But again, what I'm not hearing is people just going, this is terrible, this is stopping us innovate.
Yeah.
What I'm hearing is like, this is good, this is clearer, I could do with some more clarity, I'm not entirely sure how to do this bit, or sometimes I'm doing this and some people say yes and some people say no, so we've got work to do. But it's not like, I'm not going to do this because it's a waste of time or we shouldn't do it. So that's a step forward as well.
And is there anything you've been surprised that hasn't been mentioned as much? So for example, I've been surprised there's not been actually that much discussion around Agentic AI.
Yeah, Agentic AI has been kind of absent in that as well. And I think Agentic AI, where artificial intelligence has a bit more autonomy to actually act, is a very hot topic generally in AI circles just now. I've spent a bit of time thinking about it and looking at how you might do some of the compliance work for this too, and it's pretty complicated. I think that people are still, if I'm honest, people are still only just getting their head around the use of machine learning and image processing. Absolutely. And then large language models, we've got some coming out there right now. We've seen the first Class 2B LLM-powered device out of Europe, which is the Prof. Valdine Clinical Decision Support. So that barrier has been crossed. No one knows exactly how it's happened, but it's in there. So there's this kind of promise. So that is really advancing. But the agentic side of things is possibly that bridge too far. Now, I spend a lot of time thinking about this. At Curistica, we're building out agentic features of what we're doing too. But it still feels like early doors, and there is a lot of unknown and a lot of complexity in there. There's a lot of value in just extracting the value out of what we've received already.
Yeah.
So I think we need to sort of watch this space. I think next year we might hear some more, but we've got a lot of things to unpack just with like LLMs.
I think you're right, and I think in a way it's not a bad thing that that's not been mentioned, because like you said, there's the realities of the technologies that we've got at the moment is coming very much to fruition in terms of how people and the NHS specifically are looking to start integrating this technology, and ambient scribe is a great example of that. So yeah, I was expecting perhaps that sometimes people do look a bit too far ahead at the very bleeding edge of emerging technologies such as agentic AI, but it's not. I don't think it's a bad thing that's
well, I mean, I don't know what you think. It's like maybe it's a bit of realism of this. Someone once said that even if the large language models that we had were frozen at GPT-4, which is a couple of years ago now, we still have decades of improvement just off that.
Yeah.
But yet it's just there's more and more and more and more, and I think we've got such a kind of loaded plate with so much tasty stuff on it that I think people are just like, you know what, I'm just going to kind of work on this just now. I'm going to move on to the next course a little bit later. And I like the next thing as much as the next person, but that is pretty reasonable, I think.
Yeah, and I've had some really interesting conversations about this actually. One with Dom from Tortoise, asking him about, with all of these new consumer models, which obviously can be applied to ambient scribe technology, all of these new frontier models, how are you keeping up with that and how are you applying with it? And he was saying along the lines that, we kind of stick with what's come out at a certain point and work to build that out, because there's so much value that people, and I think we might have discussed this on our when we did the podcast, that there is so much value to extract from the models that we've already got, and so many ways that people aren't using them in the way that they can be best.
But we also need a moment to catch up as well, because these tools are put into place, and we use tools to help us with what we do, but the tools that we use change us as well. And we move at a certain pace as well, and sometimes people say we should maybe move faster or anything like that, but regardless, time is still needed, because that allows us to work out, well, what is the best way to do this thing that I want to do using this new technology? Is there a better way? How do we have to change? And so AI has definitely outstripped our ability to keep up with the pace of it, but that moment allows us to sort of think a little bit more about this, allow some of the rough edges of the newer technologies put into place. There are still problems that we have to solve with the technology that we have. And then there's the ultimate one, which is this is all great, but it costs a lot of money. Is it actually helping save things? The ROI on this is still unclear.
What are your thoughts as well on the state of AI in the UK in healthcare? Because the landscape's changing very quickly at the moment. I went to London Tech Week last week. Keir Starmer and Jensen was there as well, and they're doubling down on, or saying that they're doubling down on pushing AI in the UK. And even if it's not healthcare specific, these discussions, healthcare always comes to the forefront of the conversation. So what's your sort of feeling about how AI is changing, or is it really in the UK?
It's kind of good timing on this. Over the last few months I was working with the Department of Business and Trade on writing a report about generative AI in healthcare as a driver of economic growth. Now, the exam question is the economic growth bit, and that probably doesn't surprise people because this is the message that's coming out from the government as well. But of course it is generative AI in healthcare. There is a consistency of message, correctly I think, about how does the UK drive growth, because we need growth not only to represent ourselves in the world, but also to be able to afford our existing public services and improve the quality of life for people who've had some really tough times recently too. And within that, report out soon, hopefully, on that, we've made some rather specific recommendations based on the direction of travel that the government has been suggesting. Now, what's interesting to me is that we finished this a month or so ago. Such is the pace of change that the recommendations, which felt very future forward at the time, some of the ones that I put in there kind of already turned up as well, and I'm like, oh my God, this is going to be out of date by the time it comes out. So there's an incredibly fast pace. People talking about we need AI. Yes, but they should be painting a picture of that's the tool to get us somewhere. I want to know, where are we going? Like, we're not going to a place that is all about AI. That's just the sort of tool. I want to know what it feels like. What is the world going to look like when we get there? Where are we trying to get to? Help us understand that. And then if AI is a big part of how to get to this point, or a crucial part of getting to this point, make the case for that, and then allow us, the experts in the different areas, working together, whether it's healthcare or anywhere else, help start to plot our course towards it. But we need to know where we're kind of going with this.
I've heard people say this before, and I think perhaps Liam Cahill has said about this.
Yeah, Liam's good at this thing.
Yeah, I think he's said a very similar thing about the NHS, the previous 10-year plan or previous plans that have come out, and it's like, it's all well and good saying that this is what we want to do, but yeah, that end goal is really important.
Yeah, what will it feel like for me as a patient, or for my wife, or my nieces and nephews, or my mum and dad in that time? What will it feel like to receive care there? Now, you could sort of get a person to describe, you'll take a hover car into the practice or whatever it is. I think what people want on both sides, if we sort of think about the patients and their families, and we think about the healthcare professionals, regardless of the technology, I think we're all feeling pretty frazzled. I think we're not feeling very cared for, or we're not feeling like we're providing care. And you've maybe heard me talk about this before, about the excitement I have about artificial intelligence is weirdly about how it's helping us, because it's challenging some of those sort of technical things that we do, because it might be able to do them better. And we get worried that, what happens then. But it kind of opens up some space. And that space is where care emerges. It takes time to sit and listen to a person when they're describing their problems, and to truly be part of that. So I get excited about this technology coming in, particularly ambient voice, when it frees up time, is that we don't put more patients in that space. We put more patient in that space, more of the person in front of us. And I think that hopefully the patients will feel better. I think the outcomes will definitely be better, but critically, I think the people delivering the care will feel better. So when we talk about that destination of where we're going to get to, I'd like to hear someone talk about, at this point, the exact shape of it may not be entirely clear, because that's not for me to determine, that's for us all to determine. But we will feel cared for at the time. We will feel better, we will feel listened to. Our nurses and doctors and staff will not feel flogged and burnt out and want to go into whatever else as well. And then we will be better as a result. And then there may be some detail on that, but I think we need to feel hopeful about not just having just more and more stuff crammed in, but feeling that we get more quality out of what we've got. So I'll leave it for the leaders to determine exactly what that is. AI can help that, we've seen that, but there's other non-AI technologies, and there's some non-technologies that can help that. Lay that out, fund it, allow us to do it, and then we're off.
Absolutely. And did you by any chance see the Neko keynote with Neko Health?
No, gosh.
And did you see Penny's?
I haven't seen any of those. I've been stuck to my stand, tell me about.
I was just wondering. So, the Neko one was chaired by Hassan Chaudry. He did an incredible job, actually.
Of course he did.
I've not seen him do a panel before, and it was amazing. But it was very interesting to hear about what Neko are doing. I'm familiar with their work, but not had the chance to sort of look into the extent of it properly. And
I've had an echo scan. So.
Oh, have you?
Yeah.
And what was your experience like? Because
I enjoyed it. Yeah, it was good.
He was demonstrating some very interesting follow-up analytics, so year on year.
Yeah, that was the big thing that they you can say you go and they want to get you back the next year, and you say, well, they're trying to make some money off me again, but they made a very, very convincing point. It's just like you got a point, information, but it's the change, it's that difference. And so I accept that, and I will probably go back to do it too, to see how things have gone. But I think that's a really good point. And they also get to aggregate data across a large population that allows you to get sort of comparators there too. So I think that's and they're using kind of not basic technologies, but they're using kind of mostly tried and tested technologies, but just assembling them. I think that's good.
Yeah. It was interesting to hear him speaking about how much of it is done in-house, from the hardware to the software. And it's a very integrated ecosystem, and the results that he showed as well. Obviously, results don't say everything when they're not independent, but they were promising results that he was showing about the improvements year on year. So
well, I haven't got to that year on year. I mean, all I can say about the Neko, the experience was really nicely done, was well handled by the staff. It was interesting to have all these tests. I got some really interesting insights for myself. There was a couple of little things that I followed up on that actually they handled themselves, which was pretty good. They made it very easy for me to get my data, which is a really lovely thing. Yeah, so there's a button on the website. It took a day to get it back, because there was such a large amount of skin photos. They do this sort of skin photography.
So do you get all of those photos? Wow, so that's really nice. Like as a consumer, to be able to access your data like that.
It comes as a kind of a big lump, though. I mean, it's not terribly accessible. It's like all JSON files and everything. But it is there. But the bit that I think to make it truly useful, and this is a complaint I have about how the NHS treats the independent sector, however you feel about that, there is just like a barrier in the data being able to move to and fro. So for me to get that data from Neko into my GP system, or into my NHS record, would literally require me to either kind of print it out and then get them to code it again, or, it would be very helpful for that information to make it back, because I had some blood tests that would be part of what would be standard screening for me, but it's not going to get back to the GP apart from a printed version. I mean, I think the data that's generated by my interaction with health and wellness should be available to the people providing care wherever it is, at whatever point, and we're not doing a terribly good job of that even within the NHS. But then to throw up barriers elsewhere, or for barriers for patients to be able to integrate their information back in, we're missing a trick, because one of the really important things to say about the UK when you think about the world as it is right now, and how does the UK stand up and say we are going to be the best at X, Y, or Z, particularly with AI, what can we do and not be sort of laughed off stage with? We can do things right. We've got great academic, research, clinician workforce, industry, a history of innovation. But one thing that we really do have, and I think we are without parallel in the world, is we have data. Now, we don't have as much data as some places, and the data is in different places, and sometimes it needs cleaning up and everything like that. But we made a decision decades ago about how we were going to have our public services provided, and with that came a decision about how we handled that data. We have an enormous amount of longitudinal data in multiple public services, cradle to grave, sometimes in paper, more recently digitally, that will continue to grow across nearly 70 million people. There's nowhere on earth that can do that. It can be highly homogeneous in some areas, very diverse in other areas. We are in the sweet spot if we can get the data to work for our care. But in a world where the one thing that AI needs, this important technology, is good quality data, that is where the UK can absolutely smash it into orbit, and at the same time help us all. Now, there is a lot of complexity in that as well, but if we can unlock that, that is really incredible.
Yeah, that's extremely exciting. And it was interesting as well, you talk about what the UK can do especially well, and Penny, she mentioned that genomics is the UK's strength at the moment.
Yeah. Said, gosh, I haven't even mentioned the genomics, but yes, of course.
Yeah, so, and she was saying she's been told, she's like, I don't know how true it is, but she said that the UK is arguably 5 to 10 years ahead of anywhere else in the world in terms of...
We've made some, previous governments and previous fundings have led to really large stores of this data, high resolution data, genomic data across large members of the population. They've taken efforts to make sure that it's quite representative as well. It's there. We have this other data, we have all these other services. It's not just healthcare and all these other... Together, we could use that to really improve how it feels to live and be in the United Kingdom, and actually demonstrate to the world this is how we can turn it to good. We can explore the best ways to generate this data. We can explore how to take it from area to area and do it securely and responsibly. We have to work with the patients and the families and the citizens of the country as well to make sure they're brought along on this journey, so they don't feel it's being done to them. Maybe giving them better access to their own data would help. That could be great. And again, this could get us better precision of medicine. But actually, at its simplest, a person goes to the hospital. If you can get access to what happened in another place, just the care could be better. So even if it was just for that, I'd vote for it.
Well, thank you so much, Keith. That was a great chat.
Thank you.
We could talk for a lot longer, but we...
I know my glasses were bleeping away in the background. They ran out of power halfway through, which is good because I'm sure I'd had another call. But it's always great, man.
Thank you very much.
See you later.